Welcome to the University of Iowa Healthcare Organ Transplant Center video education series. This video will share the benefits and risks of different donor organ options. Not every option will be right for you. Your choice is very personal and will depend on many factors such as your personal health history. Wait lists for transplants in some parts of the country are growing. This means it takes longer to get an organ now than it used to. Due to shifts in national policy and demand for transplants, this has been especially tough for rural communities. However, waiting for a transplant may not be safe for you. You can become sicker while waiting and at some point may no longer be eligible for a transplant. One way you can skip a long wait is by having a willing, healthy, and approved living donor. If you have a living donor, there is a separate video covering that transplant process. Those without a living donor will join the wait list for a deceased donor organ. Organs on the wait list are not all the same and come with varying risks and quality. You may get a transplant sooner if you're willing to accept some of these risks. However, waiting itself can also be risky and come with more unknowns. No one ever knows when another offer will be made, what your health status will be at the time, or the quality of the next organ. The question will always be, do I take the organ I am offered now, or wait to see if another one comes along? No matter which option you choose, you will sign a consent form during or after your evaluation process. This is so organs can be offered to you once you are listed. You are free to turn down different options and it will not negatively affect your care. However, turning down organs will likely increase your wait time for a transplant. Some options are organ specific and some apply to all organs. You will have time to read the consent form and ask questions during your transplant evaluation. You can also change your mind at any time. In addition to your wait list decisions, there are several other options to consider when accepting donor organs. Kidney Donor Profile Index, or KDPI, is a way to group kidney donors. This donor option is only for kidney transplants. All donors are given a number from 1 to 100 based on different factors. The number tells us how long a deceased donor kidney might function compared to all other kidneys recovered in the past year. While many factors can affect the kidneys, the lower the KDPI, the longer the kidney may function. The term half-life is used to describe how long a kidney might last. It's calculated by entering a given KDPI score into a formula based on the condition of the kidney. The half-life is the average number of years that half the transplanted kidneys of that group still function. It doesn't mean your kidney will stop at that time. It means half of that type of kidney are still working in a large group of patients. The national distribution system also prioritizes organs to specific groups. Organs that usually last longer are often given to younger people with longer estimated lifespans. Low KDPI organs are typically offered to children and young healthy adults. These kidneys are expected to work for 11.5 years. Organs with a KDPI between 20 to 85 make up most deceased donor kidneys. They are expected to work for almost 9 years. You may be asked to consider high KDPI organs as an option. These kidneys often come from donors that are 60 years or older, or 50 years or older with high blood pressure, diabetes, slightly reduced kidney function, or that have died from a stroke. These kidneys come with both risks and benefits. The benefit of accepting a high KDPI kidney is that you will be transplanted sooner. No one can predict how long it will take for another kidney to become available, or if you will be healthy enough to get another kidney when offered. The risks of a high KDPI kidney are all relative. These kidneys have an expected half-life of 7 years. This is about 2 years less than most donor kidneys. Another risk is that high KDPI kidneys have a greater chance of not working as well at first. Patients getting high KDPI kidneys are 2 times more likely to need dialysis for a short time compared to lower KDPI kidneys. This can increase how long you stay in the hospital, change your initial immunosuppression, and increase your chances of an early kidney biopsy. Making this decision is complex. Your choice is also influenced by your own risk profile, the transplant center's wait time, and your personal choices. If high KDPI options could be right for you, you will get more details from your care team. Remember, if you agree to this option, you will hear about the offer when the organ is available. You will make a decision that is best for you in that moment. Risk criteria donors are an option for all organ transplants. Risk criteria donors are donors who have a potential risk for 3 infections: HIV, hepatitis B, or hepatitis C. Almost all recipients should strongly consider this option and sign the consent form if they agree with the risks. The large increase in deceased donor transplantations over the past few years is due to donors like this. Each donor, deceased and living, is tested for common transmissible viruses like hepatitis B, hepatitis C, and HIV before donation. Most donors test negative. There are some organ donors that are thought to be at higher risk of transmitting these viruses, but still test negative for them. These are called risk criteria donors. The risk of a virus being passed on from one of these donors is very low, but not zero. The test for these viruses can miss a positive result, especially if the donor was recently infected. The Public Health Service defines risk criteria as donors with specific behaviors within 3 months before donation. These behaviors are injecting drugs for non-medical reasons, incarceration for more than 72 hours, a man who has had sex with another man, sex in exchange for drugs or money, sex with a person known to have sex in exchange for drugs or money, sex with a person who injected drugs for non-medical reasons, sex with a person known to have HIV, hepatitis B, or hepatitis C infection, donors with unknown medical histories, children breastfed by a mother with HIV infection, and children born to a mother with HIV, HBV, or HCV infections. The risks of disease transmission are low, but depend on the virus and the behavior. The lowest risk of transmission, less than 1 in a million, is for hepatitis B in someone who's been incarcerated. People who inject drugs for non-medical reasons have the highest risk transmission for hepatitis C. The risk for this combination is 0.32%. The risk of transmitted HIV is 0.4%. To put these risks in perspective, around 4% of people die each year while staying on the wait list. The risk of getting hepatitis C while staying on dialysis is 0.34% per year. The risk of dying in a traffic accident is 1% per year. When considering risk criteria organs, it is important to consider 2 more points. There is a very rare chance you get infected with hepatitis B or C, and both diseases can be cured or controlled by taking medicine. All recipients who get risk criteria donor organs are also tested often for viral infections during the first year after transplant. Most of these organs come from donors that tend to be younger and healthier than the average donor on the wait list. If you don't want to accept a risk criteria organ, the other option is to stay on the wait list until a different organ with its own risks is available, whenever that may be. Now let's turn to the last option that we'll cover in this video: donors who have been previously cured from hepatitis B or C, or those still actively infected with hepatitis C. These can be excellent donors for some kidney and liver recipients. The benefit of this option is that these organs may be more readily available. The downside is that you will likely need to take oral medication to prevent or treat an infection. These medications are very effective, and while the risk of transmission can be low, there may be side effects from the treatment. An infection can still occur, and if not successfully treated, these viruses can cause hepatitis or inflammation of the liver. This can lead to severe scarring of the liver, known as cirrhosis. All potential transplant candidates are tested for prior exposure to these viruses at the time of evaluation. This helps decide if this option is a good one for you or not. Your care team will suggest certain vaccines before transplantation that may affect your choice. The risks differ if you have been exposed to the virus or vaccinated against it in the case of hepatitis B. The risks will also differ depending on if you are in need of a liver or kidney. After approval from your care team, if you decide to accept these organs, you will need to read and sign a consent form. If you choose this option, it means you will receive these offers in addition to all others. It can be confusing to weigh the risks of each of these donor options. Here are some tools for you to help you better understand these risks. Signing the consent forms for any option will not exclude you from other waitlist offers, and you are not required to accept any option offered to you. Your transplant coordinator and surgeon will discuss the details with you at the time of the offer, but you will be reminded that no one can predict what the future holds. For questions or more information, please talk to your transplant nurse coordinator at the University of Iowa Healthcare Organ Transplant Center. You can also review any of these excellent resources listed here. Thank you for watching.